Dr. Joss Reimer, Chief Public Health Officer of Canada, Andrew Lawrence, Director General, Travelers Operational Guidance and Support of CBSA, Sebastien Beaulieu, DG Emergency Management at Global Affairs Canada. After a few remarks, we'll take questions first in the room and then on Zoom. Si vous êtes sur Zoom, vous pouvez utiliser la fonction lever la main quand vous voulez et on vous donnera la parole après les questions dans la salle. On that, officers, officials, you have the floor.
Okay. Thank you everyone for joining us this afternoon. Merci d'être avec nous cet après-midi. Before we begin, I do want to acknowledge that we're gathered on the unceded traditional territories of the Anishinaabe Algonquin Nation, and I do want to take a moment to reflect on the history of Indigenous people and to honor the original stewards of the lands where we live and work. Le 2 mai, l'Organisation mondiale de la santé a été informée d'un groupe de personnes à bord d'un navire de croisière MV Hondius atteint d'une maladie respiratoire aiguë, grave, dont on sait désormais qu'elle est causée par le hantavirus des Andes. Depuis ce moment, l'Agence de la santé publique du Canada et Affaires mondiales Canada, en collaboration avec les autres ministères et organismes du gouvernement du Canada, travaille avec des partenaires nationaux et internationaux, notamment les États-Unis, le Royaume-Uni, l'Espagne et les Pays-Bas, ainsi qu'avec l'Organisation mondiale de la santé, afin de surveiller l'éclosion à bord de MV Hondius et de mettre en place des protocoles de santé publique appropriés ainsi que des mesures de soutien pour les voyageurs qui reviendront ou sont déjà revenus au Canada. I recognize that Canadians may find the news or images about this issue to be upsetting, particularly given our recent experiences during the COVID-19 pandemic. And this situation is serious. And I want to be transparent with Canadians about what we know and what we don't know. This is not a new virus. Hantaviruses are a group of viruses that naturally occur in or naturally infect rodents and also can occasionally infect humans, usually through contact with infected rodents, their droppings, or saliva. The species of hantavirus in this outbreak is the Andes virus, which is the only species of hantavirus known to cause limited human-to-human transmission. The Andes virus is found in South America. It is not found in Canada. At this point in the investigation, it is believed that the first case may have been exposed while traveling in South America before boarding the ship. At this time, the overall risk to the general population in connection with this outbreak of the Andes hantavirus is low. Onward spread within Canada is not expected, even if an infected individual were to arrive here. However, given the rarity of this virus, it is important that we take a precautionary approach to ensure that Canadians are protected. Nous pouvons confirmer que 6 Canadiens se trouvaient à bord du navire. 2 de ces passagers sont rentrés au Canada la semaine dernière, avant que l'éclosion ne soit détectée. Ces 2 passagers, ainsi qu'un autre Canadien, se trouvaient à bord d'un vol à destination de Johannesburg, en Afrique du Sud, et pourraient avoir été en contact avec une personne présentant des symptômes. Ces 3 Canadiens sont rentrés au Canada le 26 et 27 avril. 2 de ces personnes se trouvent en Ontario et une au Québec. Elles ont reçu des consignes de mise en isolation et font l'objet d'une surveillance active par les autorités de santé publique locales. À l'heure actuelle, aucune de ces 3 personnes ne présente des symptômes. In addition, public health investigations are also underway by local authorities regarding 3 additional Canadians, 2 in Alberta and 1 in Ontario, that were on another flight where they may have had brief contact with a confirmed case and have since returned to Canada. I want to be clear that there is no evidence that asymptomatic individuals can spread hantavirus to others. However, as illness could develop at any time, we are still recommending that these individuals stay isolated until their risk period for the appearance of infection has passed. We have also been in touch with the 4 Canadians who are still on board the ship. At this time, none of these 4 passengers are reporting any symptoms. And I do want to note that we know this is a challenging time for them. I can only imagine what it would be like to be a passenger on board, not knowing if you've been exposed, nor when you might be able to come home. And the Government of Canada is offering support and is working on a process for their safe return to Canada. The MV Hondius is currently en route to the Canary Islands and is anticipated to arrive on May 9th or 10th. There is a team of experts on board the ship right now ensuring the safety and health of all passengers before they disembark, and also doing a risk assessment so that we can better understand what precautions we may need to take upon their return. We have arranged for a public health officer from FAC to travel to the Canary Islands to support the Canadian passengers. This FAC officer will monitor the process when the Canadians disembark and to ensure that all public health protocols are followed. Once they arrive in Canada, these passengers will be directed to FAC officers for screening and next steps in coordination with local public health authorities. Bien qu'il n'existe aucun traitement spécifique contre le hantavirus, nous disposons au Canada des capacités de diagnostic et des soins de soutien nécessaires au cas où un voyageur étant d'une infection à hantavirus en aurait besoin. Compte tenu de la période d'incubation de l'hantavirus des Andes, qui varie entre 1 et 6 semaines, avec des cas d'incubation plus longs ayant été signalés, il est possible d'autres cas surgissent, notamment liés à des expositions survenues avant la mise en place des mesures de confinement. We have robust processes and procedures in place, and further spread of the virus within Canada is not expected. It is also important to note that hantavirus is quite different from viruses like COVID-19. Infections with hantavirus are rare, but they are also a real risk in Canada. However, in Canada, the source of infection is typically through contact with infected rodents or their urine, droppings, or saliva. This can be a particular risk when people are cleaning rodent-infested spaces. The hantavirus infections found in Canada are caused by the Sinombre virus, not the Andes virus, which has not demonstrated transmission from person to person. To reduce the risk of infection from all types of hantavirus, we advise people to stay away from rodents and safely clean and disinfect areas contaminated by rodents. So in closing, I want to reiterate that we are taking this outbreak very seriously. The Government of Canada has stood up a strategic response team to ensure a coordinated, whole-of-government approach to this matter. In addition, I provided an update to my counterparts in the provinces and territories yesterday, and we discussed public health measures to contain this outbreak. And I want to thank them for their advice, their expertise, and collaboration. We will continue to work closely with provinces, territories, the World Health Organization, international partners, and local authorities, and will provide updates on the measures being taken. Thank you. Merci. Miigwech.
Question period.
Permettez-moi d'enchaîner avec quelques mots de la part d'Affaires mondiales Canada. Global Affairs Canada is mobilized and coordinating closely with the Public Health Agency of Canada, Spanish authorities, and international partners to support the safe return of Canadians aboard the MV Hondius. There are 4 Canadians currently on board this Dutch-registered vessel. They, and all passengers, in fact, are reported to be asymptomatic by the European Centre for Disease Prevention and Control, who are on board. GAC consular officials are in ongoing direct contact with the 4 Canadians to provide support and information as needed. We've been actively tracking this situation since the weekend, and this has included engagement through our embassies in Dakar and Madrid as the ship progressed from Cabo Verde and its expected arrival to the Canary Islands on Sunday. Our current efforts follow a repatriation request from Spanish authorities who agreed to receive the cruise ship in the Canary Islands, and they are asking partners to repatriate their nationals. Je tiens ici à remercier les autorités espagnoles d'avoir accédé à la demande de l'Organisation mondiale de la santé et d'avoir soutenu la réponse mondiale en matière de santé publique. Le navire Hondius devrait donc arriver à Tenerife ce dimanche. Un membre du personnel de notre ambassade à Madrid s'est rendu aux îles Canaries dès jeudi, c'est-à-dire hier, et sera là pour l'arrivée des Canadiens. Et il sera accompagné, comme l'a dit ma collègue, avec un représentant de l'Agence de la santé publique du Canada qui arrive aujourd'hui. Donc, notre équipe localement est en contact avec les autorités espagnoles et nos partenaires en prévision de l'arrivée du navire. Et nous travaillons en étroite collaboration avec nos homologues espagnols et nos partenaires afin de coordonner les procédures de débarquement, les protocoles de santé publique locaux et les modalités de transfert et de départ des îles Canaries. Soyez rassurés que nous prenons toutes les mesures nécessaires pour le rapatriement et le retour des 4 Canadiens en étroite collaboration avec l'Agence de la santé publique du Canada. Merci.
Question period? Or do you have no? That's it. Merci. On va maintenant passer à la période des questions. I was reminded that this is an on-the-record technical briefing, so the officials can be quoted. Please limit yourself to one question, one follow-up. We'll start in the room. If you're attending on Zoom, please use the raise hand function at this moment, and I'll give you the floor after a few questions here in the room. Première question, Antoine Trépanier, La Presse.
Bonjour. Ma question est pour Monsieur Affaires mondiales. Peut-être répéter votre nom et votre titre pour qu'on puisse bien le saisir. Ma question est par rapport au rapatriement des 4 Canadiens sur place. On a vu les Américains qui ont annoncé le déploiement d'un avion nolisé pour rapatrier les 17 Américains. Est-ce que le Canada a nolisé un avion? Et sinon, comment est-ce que vous allez procéder pour les rapatrier en sécurité?
Merci. Je m'appelle Sebastien Beaulieu, directeur général de la gestion des urgences à Affaires mondiales Canada. Je ne suis pas en mesure de donner les détails des modalités du rapatriement des 4 Canadiens, mais ils seront de retour au Canada dans les plus brefs délais suivant leur débarquement du navire aux îles Canaries attendu dimanche.
Est-ce que vous pouvez garantir qu'effectivement, ils vont pouvoir descendre débarquer aux îles Canaries, considérant les conditions météorologiques qui s'annoncent un peu difficiles et que déjà les autorités espagnoles ont dit que ça pourrait être repoussé ou bien que la destination finale, par exemple, de certains passagers pourrait être repoussée à une autre île, peut-être éclairé sur votre niveau de confiance de pouvoir effectivement les rapatrier d'ici lundi?
J'ai insisté sur l'arrivée prévue du navire, évidemment sujet à la météo et aux intempéries locales, mais le plan est qu'ils arrivent aux îles Canaries aux alentours de dimanche. Et suite à ça, il y aura les protocoles mis en place par les autorités espagnoles de concert avec l'OMS et le ECDC européen pour déterminer les modalités de validation des conditions de débarquement des passagers et de nos 4 Canadiens qui seront accueillis et transférés par la suite.
Next up, Stuart Benson, Hill Times.
Yeah. Sorry, I just wanted, there was just to clarify, you said it was that there was a symptomatic individual that the 3 Canadians may have come into contact with. Just to clarify, was that on the plane, I'm assuming, and was that another passenger? And just in that vein, I know you said it was like asymptomatic, there's still a very low chance or it can't be transmission, but has there been efforts for contact tracing just to track down and make sure that the officials are aware of at least as many people that they came into contact with, whether it's just even like in an Uber back from the airport sort of thing? And if that's been done, how in-depth has that been?
Sure. So to answer the first question, there was one of the cases in the outbreak was on a plane that traveled to Johannesburg, and some of the Canadians were on that flight. And then there was another flight where that same case States was temporarily on the flight, but not for the entirety of that flight. So there was a short exposure for some Canadians. We are working closely with the provinces and territories regarding providing guidance to the Canadians who have been in contact with the cases, either from being on the boat or on the planes. At this point, we have no reason to believe that there's any possibility that they could have spread the virus to anyone else en route to Canada, particularly given that they have actually been in Canada for over a week now and remain asymptomatic. So even if they were infected, the likelihood that they could have transmitted it over a week before symptoms start is negligible. That said, we are also aware of what flights they've taken and just keeping some basic details available should anything need to change in the future.
Follow-up, Stuart?
No, those are both my questions.
Michel Sabat, Presse canadienne.
Bonjour, mes deux questions sont pour vous, docteur. J'aimerais d'abord savoir s'il y a un risque, une possibilité là, d'une propagation ou même d'une pandémie ici au Canada.
Le risque d'une pandémie avec le antivirus est très bas. C'est pas un virus qui peut transmettre de même façon que le COVID, par exemple. C'est beaucoup plus difficile de transmettre le virus de personne à personne. Normalement, même avec l'Inde, le subtype Inde, normalement, il faut avoir un contact long et très proche pour transmettre le virus. Et c'est pour ça que c'est pas un virus qui a potential d'être un virus d'une pandémie.
Dans un deuxième temps, j'aimerais savoir si c'est sécuritaire de faire monter à bord d'un vol commercial les 4 passagers qui sont toujours à bord du navire, parce que là, on nous parle qu'on veut les ramener au pays très rapidement. Et est-ce que vous préférez qu'ils soient isolés là-bas pendant les 45 jours ou est-ce que ça se passerait ici? Comment ça se passerait concrètement? Il y a 2 parties.
Le préférence est de n'aborder pas dans un avion commercial. C'est préférable d'avoir un avion charter. Je ne sais pas en français, charter.
Nolisé.
Merci. Et c'est pour ça que nous travaillons ensemble entre les 2 départements pour planifier une manière de réduire les risques le plus possible. J'aimerais bien que les personnes pourraient rester en place, mais en même temps, ils sont Canadiens, ils ont le droit d'être au Canada. Et si on peut bring them home dans une manière safe, c'est préférable pour eux et aussi pour nous de bring them home in a safe way.
Next up, Tessie, The Hill Times.
Hi, thank you for taking my questions. First question is, can you provide some details on the strategic response team? Who's on it? What exactly are they responsible for? And how often are they meeting? And how are they communicating with you? Like, how is all of this communication going through so that we can avoid worry or last-minute decisions, et cetera?
Yeah, that's a great question. So we are meeting daily as a group. There are multiple parts of the government involved. I know we could get you the full list. I don't want to list all of them and forget to include everyone, but we do have a really whole government approach where we have deputy ministers, we have scientific and health experts meeting every day to ensure that we are all on the same page and planning together for both the safety of Canadians who are here in Canada as well as the safe return of the Canadians who are still on board of the vessel.
Okay. And a second question would be just going back in time a little bit. Is there anything specifically that was learned, and I'll direct it to all 3 officials, anything specifically that was learned during COVID as a lesson that you're already implementing very early at this stage?
Si je peux peut-être préciser ou renforcer la réponse initiale aussi par rapport à... sorry, turn to English. Your question was in English. On the coordination, Global Affairs is also coordinating a daily call of all federal partners and departments every morning to assess the situation in connecting also our network of missions who have insights from the ground and insights from the approach being taken and actions taken by local authorities as well as our international partners. Thank you.
Dylan, Canadian Press.
Hi, thanks for taking our questions. I'm wondering if you could provide the date that the federal government had found out about the 2 Canadians who had left the ship, what date they returned home, and what date was there the contact with the symptomatic cases, or contacts with the symptomatic case?
I think I can provide you with all of those, but it might take me 1 second. I have a list of events, so I don't know if you have another question. I can try to find those while you
Sure.
ask somebody else.
Thank you. Mr. Beaulieu, you mentioned not being in a position to talk about how the 4 Canadians are getting here, but there's a lot of worry out there. I'm wondering if you could maybe talk about the flight paths, about are they staying in Spain, are they going straight to Canada, and what exactly these protocols look like. Maybe the CBSA can tune in, can add to that, but what does it actually look like? Are they wearing masks? Like, they're not in a bubble. Like, how is this actually being done? What does that look like?
I'm not at liberty to currently speak of the full modalities of the return of the 4 Canadians, but I can reassure you that all the measures will be taken. Doctor mentioned the necessary distancing and protective and PPE equipment to be worn. All those measures are being taken into account for the prompt and safe return of the 4 Canadians when they disembark the Hondius in the coming days.
Can I add to that? Part of the reason that we haven't finalized the plan is that there are currently health experts on board who are doing risk assessments, and we have not yet received the information that they are collecting. There's still hundreds of people on that vessel, and so those health experts will be compiling that, and we want to use that information to help inform the decisions we make about the safe return of the Canadians.
And the question about the dates, I don't know if Dr. Reimer, you wanted, yeah, thanks.
So the flight to Johannesburg was on April the 25th. So the Canadians would have been on that flight where they were exposed. They then returned to Canada on the 26th or 27th. WHO was only notified of the cluster of cases on May the 2nd. And very quickly, I think thereafter, within the next couple of days, it was recognized to be hantavirus. We received notification on the Canadian passengers on May the 6th and immediately sent that information around to the provinces and territories who, for the individuals that we were notified on the 6th, all of them have been in contact with the provincial or territorial public health authorities and have received guidance around isolation. We received a second notification yesterday about the second flight, and several of those contacts have already occurred and have been given guidance about isolation, and we are just finalizing the work as we speak with one of the individuals to ensure that they also have the information.
Merci. We'll now go online for questions. I recognize a few hands, but if you are online and you want to ask a question, please use the raise hand function at this time. Si vous êtes en ligne sur Zoom, veuillez utiliser la fonction lever la main pour que je puisse vous reconnaître. First up, online, Tashona Reed from CBC. You have the floor.
Hi there. Thank you for taking all our questions. I just have 2 questions. Have all of the 6 Canadians currently in Canada been tested for hantavirus? And if anyone starts to show symptoms, what's the treatment plan?
That's a great question. I'm really glad you asked it because we have not done testing for any of the individuals in Canada because there is no validated test for asymptomatic individuals. That means if we were to do a test on them, and my biggest worry is if it came back negative, that could falsely reassure them that they're not infected when in fact we wouldn't be confident of that and might lead them to take less precautions than what they've been directed to take from us. We might also have the risk of having a false positive where it comes back positive despite them not having an infection. It's a very rare virus, and so that false positive could cause a lot of anxiety, fear, and reactions that are not required for them. And that's why we're making sure that we're asking all of them to isolate, because we do know they could develop symptoms at any time and become infectious at that time. And that guidance wouldn't change even if they tested negative or positive. We would still be asking them to stay isolated until they're outside of the window of where they could be infected or become symptomatic.
Follow up, Tashona? You're still muted.
Hi there. Sorry about that. Just my follow-up was, if someone does develop symptoms, what's the treatment plan?
Thank you for repeating that question. We have connected with the provinces and territories who have travelers in their jurisdictions, and each province or territory has come up with a plan where they've identified a specific hospital that has the capabilities to manage a complex virus like this. And so there would be a plan to transmit those or to transport those individuals to the designated hospital for care, and with good protocols in place to ensure that nobody else is exposed during that transportation.
Next up, Heidi Petrasek.
Thank you.
Next up, Heidi Petrasek, Global.
Hi there. Thanks very much for taking the questions. I'm wondering what the isolation instructions are specifically for the Canadians, both affected here and the ones that will be coming here in terms of duration. I've just heard different lengths of time. I'm wondering what your guidance is for Canadians.
Yeah, thank you for that question. So we are finalizing that with our international partners, with the provinces and territories. Right now, we're still missing a lot of information about the extent of contact that the travelers may have had on the plane or even on the boat with cases who were symptomatic. And that would tell us whether they were high risk or low risk close contacts, and might change the amount of time that they would be expected to isolate. So right now, we've asked all of them to isolate as we're collecting more information. Likewise, we're waiting for the risk assessment from the health experts on the boat, on the ship, so that they that also can help us come up with a plan whether they would be considered high risk close contacts or low risk close contacts, and would then change the amount of time we would expect them to isolate.
If I may complete that on the basis of our exchange with the passengers and our direct contact with them, they are not currently considered to be contact cases. Thank you.
Do you have a follow-up?
Yes. Yes, thank you. I'm just wondering when you anticipate you'll be able to make a decision on how they will travel back. How long do you think it will take before you have that information, both for them and for everyone else?
Plans are being finalized in accordance with the necessary safety precautions and measures, and will be announced as soon as possible.
Next up, Mustafa Al-Assar, the Globe and Mail, yes.
Hello, can you hear me?
Yes, we can hear you. Go ahead.
Yeah, thank you. I want to ask, are there any new developments regarding the medical situation of the 4 Canadians who are still in the boat? And also, the first infected person was reported on April 11. However, the WHO only notified by May 2nd. Why this delay in reporting happened? Thank you so much.
You can take the first.
I'll answer the first part of the question. The European Centre for Disease Prevention and Control have health experts on board the vessel, and have confirmed no later than this morning that all passengers, including the 4 Canadian passengers, remain asymptomatic. Thank you.
So regarding the timing of the first case, that is correct that the first case passed away on April the 11th. At that time, there was not suspicion of hantavirus, and so it was treated as an individual situation and not reported as a potential public health risk. The second individual, when they became ill, there started to be some suspicions as that person rapidly progressed in their illness. But still at that point, we did not initially know that it was hantavirus. And even once armed with there only being 2 cases, those 2 had traveled together throughout South America and could have been exposed to a common source. And since hantavirus does not typically transmit person to person, the individuals looking at that case had no reason to suspect that this was a human-to-human transmission situation. However, the third case occurred very quickly after the second, and that's when suspicions and the public health response ramped up very quickly. We started doing testing, and it came back with a confirmation that it was hantavirus, with the suspicion that human-to-human transmission might be occurring, which that suspicion grew as further cases developed.
Merci, thank you. There's no more questions on Zoom, and since I don't see any more questions in the room, yes? Was that?
I just got a breaking update. I had mentioned that we were just, as we speak, connecting with the final person in Canada. I've been told that we have connected with that individual, so they have received the information about isolation, and so now all of the individuals who potentially were in contact with cases and are in Canada have been given guidance on isolation.
Merci Antoine, je vois que tu as une question supplémentaire. Vas-y.
Oui, je voudrais juste savoir la provenance des Canadiens qui sont encore sur le navire. Est-ce que vous avez la province d'où ils viennent? Est-ce que vous avez plus de détails à nous fournir par rapport à ça?
On a ces détails-là, mais pour des raisons de vie privée, on n'est pas en mesure de les partager, mais les informations seront partagées avec les autorités locales en temps et lieu. Merci. Oui, on est en contact. Ils restent asymptomatiques. Évidemment, c'est une situation difficile qu'ils traversent. Ils ont hâte de débarquer, de rentrer au pays et sont reconnaissants de l'aide et de la perspective qu'on leur offre de rentrer au pays rapidement. Merci.
Heidi, online, you had another follow-up?
Yes, sorry. Just based on that development, how many Canadians does that mean that are here currently are affected and have now been contacted then, just so I make sure I have the right number?
Yeah, I think there are 6 individuals in Canada who potentially were contacts and are now receiving guidance for isolation. En français, il y a 6 personnes au Canada qui peut être contactées au cas. Et toutes les personnes au Canada ont reçu le conseil d'isolation. 6 in Canada, and there's 4 additional people on the boat.
So 10 Canadians in total?
Yes.
Okay, good.
10. Yeah.
What?
Michel?
Yes, there are 6 people here in Canada, and there are 4 other individuals on the boat.
Merci. Michel, Presse canadienne.
Monsieur Beaulieu d'Affaires Canada, juste pour être clair, est-ce que vous envisagez de nulliser un vol?
Ça fait partie des options.
Okay. So I see no more question. Oh, Dylan, maybe last one.
Hi, Dr. Reimer. Just wondering if you might be able to, again, walk us through what it might look like. I realize you're waiting for the actual analysis on the condition of the people that will be reaching Canada, but I'm just wondering in terms of protocols, like what is the range of the minimum and the maximum of protection that it looks like? And especially, we haven't heard from the CBSA during this whole press conference if they wanted to add anything on what's being done to prepare for the arrival of these 4.
Yeah, so as I said, we don't have the final plans for exactly what the risk level is for these individuals. However, we anticipate that likely they will also be given guidance to isolate for a certain period of time. The WHO guidance right now varies between 21 and 30 days of isolation from last contact with a case, with an additional up to 42 days of monitoring of symptoms. There are also provisions, though, for people who are truly not a close contact, that we could just monitor their symptoms without requiring isolation if we don't believe that they had close contact. So in any situation, I anticipate that we will be connecting with them and monitoring their symptoms, with isolation being a probable outcome for them.
That puts an end to this press conference. Thank you very much for your patience. Merci beaucoup à tous. Bonne journée.